Good morning again. I call this meeting to order, and welcome to this meeting of the Senate Finance and Appropriations Public Safety Subcommittee. The intent of today's meeting is to give members an overview of the governor's budget proposals for the Public Safety and Veterans and Defense Affairs Agency budgets. Secretary Moran and Secretary Hopkins are here this morning and prepared to brief the members on their budget items. Following the secretaries, I have asked staff to provide a staff overview of the budget proposals. As we know, the COVID-19 pandemic continues to present challenges for our state. The budget proposes significant new funding under the Department of Emergency Management for COVID response. Other significant cost drivers continue to be inmate health care and state police equipment needs. The subcommittee will also need to consider budget proposals for implementing funding for marijuana legalization. Now, before I turn the presentation over to the Secretary, Secretary Moran, I would like to ask to please call the roll.
Thank you, Madam Chair. Senator Normant? Senator Normant? Senator Ruff?
Here.
Senator Edwards? Senator Edwards?
Here.
Okay. Yes. Senator Peterson? Senator Peterson is here in the Zoom. Senator Marsden?
Here.
Senator Eben? Senator Eben? Madam Chair, that completes the roll. You have a quorum.
Thank you so very much. Secretary Moran, welcome. You may begin your presentation at this time.
Good morning.
Good morning, sir.
Senator, good morning to members of the Public Safety Subcommittee. Very much appreciate the opportunity to join you this morning and walk through many agencies and their budget requests. As you have rightly pointed out, some of the costs that are driving this really are COVID related and DOC healthcare costs related. Those are the large items. And unfortunately, there's not a whole lot of new programming in this budget, but with a lot of maintenance and backfilling things that have gone unattended the last year because of the budget challenges. So again, wonderful to be with you all, and appreciate the opportunity to present. This has been an extremely challenging year for our public safety agencies. And I think you join me in recognizing their wonderful efforts, certainly exemplified by January 6th when we saw the state police arrive at our nation's capital and first to arrive. We were so very proud of them and how well they were prepared and how well they were trained and how professional they were. And really that exemplifies, I think, all of our agencies, and they did us proud. So first up, and of course, we just went through yet another lobby day, and uneventful. And so that was wonderful as well. And of course, we're all anxious for today's inauguration, and our state police are on the ready there as well as our National Guard. And I'll certainly leave that to Secretary Hopkins. So first slide, Caitlin, will just be the wonderful agency heads that we have. Next one up is, we do have two new members, though Curtis Brown over at VDM has been working through the COVID crisis, so you're probably familiar with him by now. He's been doing a fabulous job, and his team. Jeff Stern moved on to FEMA, and now Curtis is there. He was the chief deputy at the time. He's doing a great job over at fire programs. The fire marshal, Chief Garrett Dyer, now has moved up. Mike Riley is leaving, and so we have two new directors since last year when I presented to you. And otherwise, I think it continues to be similar faces and a fantastic team. So first up, we'll just go alphabetically, ABC, and I recognize time. I'll try to be brief on these, but happy to answer any questions and get into the weeds if you'd like. So the Alcohol Beverage Control Commission, first one up has to do with the marijuana legislation. As you know, the governor's bill contemplates the legalization of adult use, recreational use marijuana would be located at ABC. And reason for that is because they have done a great job regulating alcohol, and to expedite the move to legalization, it was believed the ABC could accomplish that. So there's just some budget language there. And I'll just, again, in terms of, COVID, when you think about ABC, Travis Hill and his leadership team have been doing extraordinary work. The innovative policies that they've come up with beginning back in March, and working through those policies, trying to help out our restaurants. And, but then also want to recognize all of the hard workers at our 392 retail stores now. And, they continued to work, and we really recognize their efforts. And it's indicative of how well they've done, because on the merchandise inventory on the third bullet, look at, how much inventory we need to backfill. Again, it's a non-general fund appropriation, of course, but you can see, because we're well over $1 billion now in sales. So, hats off our ABC team, and they've been doing a great job. So those are non-general fund measures, and then the language on the marijuana legalization. The next up is Department of Corrections, and that's certainly, Harold Clark and his team have been on the front lines. Good news there is we are doing vaccinations now. Every Friday, DOC will post on their website. If you haven't visited, please do. There's a lot of information on their website with respect to testing. We've done an extraordinary job on testing. That was such a big issue because asymptomatic individuals, obviously didn't display symptoms of the disease. And so we needed to do mass testing, and we were doing that. We're well over 60,000 tests. So several individuals have been tested more than once. And now we're getting vaccines into arms, both on our correctional officers and our inmates. And that will be posted every Friday on their website. So doing a terrific job there. But in terms of expenditures that we're coming to the legislature to fund, is first and foremost is the healthcare. Again, not a new program, but this is just maintenance, making sure that we meet our constitutional obligation to provide healthcare to our, our inmates who we are responsible for. So that's the major increase there. There is a new project here. VCU Health is building a new outpatient clinic to address, enhanced medical services, and so we need personnel to secure those facilities. Also at Southampton, which is great. So it won't just be, the burden won't just be on VCU Health, but also Southampton Memorial Hospital. So those are those positions. Then the only one, there's two more items. The earned sentence, that's just positions. This was the legislation you all passed in special session. Every one of these inmates are going to have to be assessed and evaluated for that early release program, not early release, but earned sentence credit program. And so we do believe that will require a substantial number of positions. You did fund it last year. You put in 1.3 million in the first year and 4.5 in the second, for a total of 5.6 million. So this is just position request. And lastly, you all provided a $500 bonus to our correctional officers, but Lawrenceville was left out since they're a private enterprise, and that's in the budget now to provide a similar bonus to those officers. Next, continue on DOC. This is drug offender assessment. This has to do with the marijuana decriminalization. We're no longer receiving those fines, so we need to go to the general fund to request to continue to fund that needed. It's a very needed program, does well, but it's a replacement of funds, so it's not a new program. And then these have already been approved by the General Assembly. This is just the funding for the enhancements at some of our regional jails. And then, as you know, Beaumont was closed, and we're just transferring one person over to maintain that facility up over in Powhatan. So then, let's jump to Department of Criminal Justice Services. DCJS, y'all, they've been doing a great job as well. Really proud of Shannon Dion and her team. They've been receiving a lot of new initiatives. Not always have those new initiatives accompanied by personnel, and so there's a few positions on here to make sure that they have the sufficient, particularly in the area of grants and finance people, because their grants have increased by, grants and funding have increased by about 40% over the last 3 years. And so we want to make sure that their financial systems are properly maintained. Really essential that, the correct auditing is going on of those funds and the grants are being issued appropriately. And so we are asking for some of the some funds, and then of course the technology as well. It's a fairly antiquated system, as I'm sure you've heard from all of the many state agencies are having to upgrade the information technology capabilities. Well, there is one new program, fairly new program here, locality security grants that they're going to manage. That actually was in the governor's budget. We all approved that last year, but it was unallocated due to COVID. It's now back in the budget, but this is for the houses of worship and other locations that require, this is yet another grant program, which DCJS is more than welcome, more than happy to receive and to distribute, because they do have so much practice and experience at doing this. But so we look forward to administering this program as well. Again, it requires appropriate staff. So, with respect to the police reforms that were passed this last special session, Marcus Alert, they're involved with preparing waivers for military equipment purchases. They're continuing their work on law enforcement curriculum, the statewide professional standards, and the body worn camera grants. And so they are working diligently to implement that new legislation. And so these budget requests reflect that. Next up would be the Department of Emergency Management. Again, they have been in, Curtis Brown and his team have been hand in glove with VDH as the unified command responding to the COVID crisis. They're responsible for the logistics. And if you haven't gone to their warehouse, if you have time, it's just right off Route 95 over near the Port of Virginia and the Port of Richmond, right there in the city. Please visit it if you have any time. And they're great workers, wonderful VDM employees, as well as the Estes trucking company. They're the ones that are pushing out all of the PPE and have been doing so since April, when we started getting our PPE. So they've been doing a fantastic job and continue to do a fantastic job. And now Curtis and his team are working with VDH on the vaccination rollout, and we can get mass vaccination started, and VDM is offering their assistance. So that first line item really reflects that. We want to make sure that we use our CARES Act money, and I'm aware that VDM has provided a more detailed presentation to your staff to make sure that our CARES Act money is indeed used on a timely basis and for COVID-related items. A couple other items below on the these are just staff positions. Virginia Fusion Center. This is you're familiar with the Fusion Center. This is the center that provides, gathers and disseminates intelligence. That's who we have been working with in preparation of the inauguration, as well as our lobby day and the protests that occurred throughout the summer. VDM was very involved with those as well. So they've really had their hands full, not only COVID, but the protests over the First Amendment protests over the course of the summer, and then all the storms, which you think when VDM, you think of hurricanes and flooding and tornadoes, and of course they have been doing that as well, and they've been doing a great job at that. At one time, we actually had 3 emergency declarations at once. I think that was the first in Virginia history. But so these items reflect that increased workload And yeah, so the Emergency Operations Center, another staff person there again. So that, and then the upgrade of the audio-visual capabilities, we're using that, and it really needs to be up to speed. It slows things down when it's not, and it really does need to get upgraded. We certainly are using it. The next item is the radio cache. That, again, that's just normal upgrades. It's a communication system that we provide in case of emergency. That needs upgrades. The equity. Now this is fairly new. This reflects the wonderful work that BDM has been doing along with Dr. Underwood with the diversity, equity, and inclusion secretariat. The health equity work group started up really early. This is something that has been a pet project of Curtis, and I think he's taken it nationally. We're really proud of his work, and we need additional support for that effort. And it's just reflective of disadvantaged communities bearing the brunt of these. Certainly COVID is a prime example, but that happens in flooding as well. Lower income communities are subject to more impact of natural disasters, but then certainly in COVID, it has been reflective of that disproportionate impact as well. And so that's why we're asking for additional positions. And then the iFlows, that's the integrated flood observation warning system. System needs overhaul. We really need to study it. Is this the appropriate technology? It's antiquated at this point, but with increased flooding, we do need a system. And if it's iFlows or not, but we need to get on that. This has been asked for a couple of times, and the budget just hasn't been able to afford it, and we're asking for it again. Next up, Division of Forensic Science. Again, this is really just backfilling, making sure with the appropriate personnel. I'll say the toxicology is up, so I suspect the attorneys on the line are probably thinking, well, the caseloads have gone down because of court cases have gone down, but toxicology is up. Overdoses, blood tests, they're driving while intoxicated. So that reflects the increased workload with respect to toxicology. Laboratory equipment, that's perennial request to make sure we have properly working lab equipment. You all know how important that is. So that's DFS. And then Department of Juvenile Justice, don't have a whole lot of new items there either. In the middle of the COVID, we did have two escapees, two of our residents escaped through the fence at Bon Air. They were eventually captured, but Valerie Boykin did go ahead and have an assessment of the security at Bon Air conducted, and these items merely reflect their findings that there had to be some increased and improved security at Bon Air. Make sure that doesn't happen again. Department of State Police, there are a couple of large items here. First of which we just unfortunately can't avoid. This is the fleet. The Ford Interceptor sedans have been used, and they're no longer being manufactured by Ford. And they've looked at other sedans, but the Dodge Charger, for example, whatever, I can't recall what it is, but whatever the Dodge Charger, it doesn't work with our STARS radio system. I'm not a car mechanic, but I know at State Police, if you need any other information on that, we have a long white paper on why this needs to occur, because we know it's a large sum, but DPP has gone through this and has requested $9.5 million to start implementing. What they're going to purchase is SUVs. But again, that's because they're no longer being manufactured, and no other sedans are available. Then IT training facility, very small. It's an electronic summons. That's non-general fund as well. That's that $5 fee. It seems to be very popular. Let me jump to parole board, and I think we're going to conclude. Hopefully I'm on time. Yep, looks like I'm on time. There are a couple of new items here. The we were subject of an Office of the State Inspector General report, and we really want to implement their findings that we felt were appropriate, and certainly victim notification is really important. I know there's been a swirl of political accusations around this, but we take this extremely seriously to make sure our victims are notified. And we have a pro board chair, Tanya Chapman, and she certainly is agreeable to this. She's recommended many of these things, so she's doing a great job, and these really reflect that OSIC, and there's actually legislation on that as well. More transparency, and some of it's going to require some technology upgrades of course, of our chorus, because if we want to put more information in there, for example, if we want to put information on why not only was somebody denied parole, but why were they granted parole, that requires additional fields. So that's some IT costs. Otherwise, the last item, 406,000, that's part-time. Our pardon petitions have soared. Now, pardons do go through Secretary of the Commonwealth's office, Kelly Thomason, but working with her in our parole board, this was our request: 7 part-time investigators to expedite the backload, and in addition to meeting current demand. Certainly, COVID has shined a light on that as well. It would like to move more expeditiously, but it requires these require appropriate investigation. The other 2 items I just mentioned there is, we are working through the fishback cases. You're all familiar with that legislation, and we're working through those. Also, the juvenile legislation that no longer, served 20 years and they're eligible for parole if they were sentenced as a juvenile. So that caseload, and then the compassionate release, which you were all kind enough to pass during special session. So that does increase the population of eligible eligible inmates for parole. And so the parole board's trying to work through those cases as expeditiously as possible. And so we're trying to staff up our parole board. So last, a couple of quick items. The marijuana, in addition to the ABC language, we also are asking for more drug recognition experts. From what we understand, there are only 22 trained DREs currently in Virginia. And based on our research with other states, if in fact we do legalize recreational use of marijuana, we can anticipate more driving while drugged, I guess you'd call it at this point. And that requires special training, because you can't take a breathalyzer. There's no toxicology that works. And so that's why it requires specialized training to adequately intercept and arrest folks for driving after, driving while having consumed marijuana. So that is why we need that additional training, and that's part of the marijuana budget amendments. And then capital outlay, just wastewater treatment plant decisions. Again, nothing new there. So that, Senator Lucas, that's the presentation. I think I've stayed within my 30 minutes, and I really appreciate any questions you might have. Happy to try to answer them. As you can see, it's not a whole lot of new initiatives, really just maintenance and supporting many of the pieces of legislation you all passed during special session, particularly when it comes to DCGS, and some of these reflect new legislation like the parole board and our transparency bill that is winding its way through your other committees this session. So
that was a fabulous presentation, Secretary Moran. Thank you so much. It's very enlightening. Does any member of the committee have any questions of Secretary Moran?
Yes, ma'am, Madam Chairman.
Senator Norman.
Good morning, Mr. Secretary. It's nice to be with you over coffee this morning. Normally, I'm hearing you on the radio, and your face on Zoom is extraordinary this morning. What I don't find extraordinary is where there are significant policy changes that are advanced under the Department of Corrections, such as restoring good time that has been advocated. Is any consideration whatsoever given to the cost of that? As I see, I can't remember the exact number, 72, 73, 74 new full-time employees just to manage that one piece of legislation.
Secretary Moran?
Senator Norman, nice to see you as well, sir. And when that bill was passed, we did request financial support. I know we worked with DOC to try to figure out a fiscal impact on that legislation, because it was something obviously very new and we needed the appropriate support. And that is, when it passed, we did request additional financial resources, and you all approved I think it was $5.8 million when that legislation was passed. So what we're asking for now is really just those FTE positions. We're not asking for the money. We've already received the appropriation.
Senator Norman?
Thank you, Madam Chairman and Mr. Secretary. I'll just make an editorial remark. I admire altruists who want to improve the quality of life of criminally convicted individuals, but it seems to me that there's got to be some connectivity between a significant programmatic change and the incidental cost of it. And putting 70-some employees just on that one policy alone, almost every slide that came up had requests for new positions. Thank you, sir.
Any member of the committee have further questions of Secretary Moran? Seeing none, I would like to introduce Secretary Hopkins of Veterans and Defense Affairs. Secretary Hopkins, good morning and welcome to the
Good morning, Senator. Good morning, members of the committee. Pleased to be with you this morning, and look forward to discussing some of the budget items for the respective agencies in the Secretariat. As Secretary Moran pointed out, obviously a lot of changes resulting from the COVID operations over the past year. As you know, the National Guard's been heavily engaged from the start of the pandemic all the way through today's inauguration security measures. So we'll be talking a little bit about what they've accomplished over the past year and the importance of some of the amendments to their continued operations. But again, thank you and pleased to be here to speak with you this morning. We can go to the next slide. So what you see here are some of the accomplishments of our Department of Veterans Services over the past year. Because of the pandemic, a lot of our offices had to go to 100% telework for a good part of the year. And it was only later in the summer that we were able to bring folks back into the offices once we had sufficient protective measures in place and the appropriate amount of PPE to protect both our employees as well as the members of the public who came to visit them. And despite those challenges, the incredible resiliency that they showed allowed them to still serve a large portion of the veterans population. And in some cases through telework, specifically when we talk military cultural competency training, allowed them to train even more folks than they had previously. And so we're very proud of the way the department stepped up through an incredibly challenging year to fulfill its obligation to our veterans and their families. We can go to the next slide. We can go to the next slide. I'm sorry. Right. My computer doesn't change over as quickly. Back to the DMA accomplishments. Thank you. DMA, as I referenced, also had an incredibly challenging year. Perhaps the largest mobilization we've had of our National Guard, certainly in Virginia's history, going back to the protest of last summer, the engagement of the Guard in working with the pandemic response, performing every task from providing testing, everywhere from the Eastern Shore out to far Southwest Virginia, and every place in between, going to our long-term care facilities, to our departments of correction, the DOC facilities to make sure that we perform testing there when we saw hotspots. So from the beginning, the National Guard has been pretty much our tip of the spear, and continues to be so. As we know, we've currently got over 2,400 members in DC supporting security efforts there, but we had also tasked them to support efforts here in Richmond for Lobby Day. And so we've called on the Guard a great deal over the past year. And as a result of the pandemic, there are some items that are included in these amendments to help support them in the event of any future operations. And so with that, if we can go to the next slide. Okay. So the first request that you'll see here on this 5th slide is for non-general funds for an access control point at Camp Pendleton. This is part of a project that the General Assembly had previously approved. The challenge that we've seen as a result in part from certain cost overruns. There was supply chain disruption over the past year, certainly related to some of the COVID challenges that they faced. There was also some wetland delineation that had to be addressed. And so because of that, we're looking at approximately a $600,000 non-general fund ask to address those cost overruns, not seeking state funding, but simply asking for DMA to have the authority to utilize the federal funds that are currently within the agency's budget. And so that's this first ask. We can go to the next slide. I'm sorry, stay there on mine, it has it separate. The language only transfer, this is an administration request within the office. So we currently have 2 non-general fund positions. One of those positions is used for our military liaison, and part of it had been funded in part by a grant, a federal grant. We learned just this past December that rather than June of 2022, when we thought the grant would be expiring, it actually expires the end of this year in December, which is why the request came in when it did. And I want to thank Senator Marston for patroning this amendment for us. But it's a language only amendment, as the funding exists within the budget and has been tied to a match with the OEA. OEA has since been restructured within the Department of Defense under a different name. And so as a part of those structural changes, as a part of the change in the expiration date and the importance of the military liaison position, we're asking for a language change to allow us to use the money that's in the budget to fund this position. The military liaison position is our direct point of contact with our installations and commands around the state. They're also responsible for bringing to Virginia over $30 million in defense community funding since 2013. And they're continuing, we're working on additional federal grants through this position. And so that's the reason for this budget amendment. Next slide, please. Okay, so this is just a laydown of our Department of Veteran Services around the state. As you can see, we've got about 34 offices in the state, going all the way out to Southwest Virginia, covering Northern Virginia, Hampton Roads, and out on Accomack. And we can go to the next slide. The request for our benefits office is to approve the hiring of 2 veteran service administrators. And these are what we term our VSAs. And our VSAs are our frontline officers within our benefits offices. And unfortunately, not every office has a VSA, which causes backlog and some slowdown in delivery of services, because it causes the Virginia Veteran Family Support Service staff, as well as our VSRs, our Veteran Service Representatives, to have to carry that additional burden. And this is one of the challenges we see in our larger offices, whether in Norfolk or Virginia Beach, that without that additional personnel, there is that backup or delay in the provision of services. These were positions that had previously been approved, but because of the budget challenges had been unallotted. And we're looking for these VSAs specifically in our Danville and Williamsburg offices, where we've seen an increase in services of more than 10 and 25%, particularly in the Williamsburg office, which has become one of the busiest offices in our state. And so that's the ask for the 2 VSA P14 positions. Okay. I'll go on to slide 10. IT security system. And this is we're trying to increase the interoperability of our security system. Again, this was funding that had been approved, but of course was unallotted during the special session. It allows us to share our systems access across our DVS offices to improve the operability. This will also let us implement certain security measures that were recommended in an assessment that DGS conducted after the Virginia Beach shooting. I would also note that this increased interoperability gives us an advantage over our federal partners because in our offices, we're able to share information from Accomack to Gate City in a way that our federal partners cannot. And so allowing this extra security measures so that our folks can notify other offices of an incident promptly will be another huge item to support our interoperability efforts here in our offices. Okay. Go to slide 11, our peer support specialists. This request for 3 peer support specialists was something that we learned was vital. It was a vital need during the pandemic, especially as we saw more veterans seeking behavioral health services. Our peer support specialists they engage in one-to-one coaching and modeling with the veterans. They're also prior service, so they have an ability to relate to veterans that we can't get with that non-veteran. Veterans tend to be more open with our peer support specialists. The challenge for us is that, for example, in Southwest Virginia, we have 1 peer support specialist that's coordinating services from Roanoke out to Lee County. In Hampton Roads, we have 1 that's coordinating services from Hampton out to Accomack. And so that creates an incredible strain on those specialists. They can't carry more than 10 cases simply because they don't have the resource capacity to do it, but the need exceeds 15. And so this request would allow us to bring in 3 additional peer support specialists and put them in the areas where the need is greatest. And in this case, it would be in Northern Virginia because of the challenge in getting around that area, but also in Southwest Virginia because of the incredible geography that the specialist has to cover. And so in the next slide, similar to our peer support specialists or our resource specialists. And this is where we start focusing really on our military cultural competency training, our crisis intervention for our suicide prevention efforts, and also to tie it into the new veterans treatment dockets that one became part of recent federal legislation. But in the last General Assembly session, Senator Reeves and others carried a bill to tie Virginia's, or to make sure that Virginia's law was in a position to take advantage of any federal resources. So now we can have veteran treatment dockets within our own state system. And so we utilized our resource specialists to connect veterans to these particular dockets, as well as other behavioral health, suicide prevention, and cultural competency services. And so our resource specialists, we're looking to bring on 2 of them to support those efforts. And you can see the amount there, the $204,000. Again, this was also funding that was approved, but had to be unallotted. And I would just note, in going through this, there's only 1 position that hasn't previously been approved that we'd be asking for throughout this. So I won't keep saying that it's been pre-approved and unallotted, because at the end, on the wrap up, you'll see the number of actual positions we're requesting. But mostly it's just funding for positions that the Assembly has previously approved. We'll go to slide 13, our women veterans. So this is a request for an assistant women veterans coordinator. About 2 years ago, the Assembly saw the need to grant us funding for a woman veterans coordinator position. And that position has been very productive over those past 2 years in expanding our outreach to our female veterans. As you may recall, Virginia has the highest percentage of female veterans of any state, at more than 108,000, excuse me. And we need to engage those veterans more directly. It's more difficult to engage our female veterans, ironically, than it is our male veterans. They're less likely to open up about their prior service. And so when we have the opportunity to reach them through other female veterans and through programs specifically designed for them, it makes our outreach efforts that much more productive. One example is the increase we've seen in our women veterans program each year, each summer. where we've seen it grow from 700 attendees to more than 1,100 attendees just in the past 3 years. So we see a growing need to provide services to our women veterans in the state, and to continue to set that standard for other states. And so that's the request for the assistant coordinator. If we can go to slide 14. And these, again, were just reductions from the special session budget to the agency budget, which recognize approximately a $3 million reduction for the National Museum of the U.S. Army, as well as about $92,900 for the War Memorial. And that was rent for the parking debt. We can go to the next slide. Talk about the capital outlay a bit for our Department of Veteran Services. And this is a direct response to what we saw come from the pandemic and the need to isolate units. One of the challenges we saw over the summer, or later in the summer, early fall, was when we saw an outbreak at both of our facilities, and the challenge in separating the residents from the other residents. And so the funding would allow for COVID-19 isolation units, as well as a storage area, where we saw we did not have that in place for the PPE needs of the respective systems. Also the filtration system, as we've seen the importance of having that in place with COVID being airborne. And that's at both centers. So if we can go to slide 16. Thank you. And along with that, the renovation projects also at the two centers to allow us to replace in Richmond, for example, the emergency generator, in Roanoke and Richmond to replace the elopement system for our Alzheimer's unit, to make sure we have protections in place to protect those residents of those particular facilities. So again, these are our life safety projects to allow us to upgrade our care centers and make sure that we have everything in place to support the residents there. Go to 17. All right, so I'll talk about our Department of Military Affairs, and I've touched on what the Guard has been doing for us over the past year. And the first item here, the protective equipment, is a direct response of what we've seen as a result of the protest of last summer, as well as the current engagement in DC. And this is a request for $50,000 to purchase protective gear. When we deploy the National Guard, we have military police officers, we have security forces within our Air Guard, but when we get into the larger mobilizations, we don't have the personnel and the equipment, or rather the equipment for the additional personnel. Our security forces and our military police have their own equipment to include riot gear and crowd control. But when we start mobilizing the numbers that we've seen over the past year, we don't have the necessary equipment on hand to provide to all those personnel. And so this would allow us to start to increase that number to at least cover what we've seen in the most recent deployments. It won't cover the larger mobilizations such as we've seen in DC, but it will at least let us get several hundred more items in place for an additional response force. And so that's the reason for the $50,000 request here. Below that, the occupational health technician is a position. We currently have one to cover the roughly 400 employees within the agency. And because they have to cover so many duties, including workers' comp, safety inspections, there's simply overcapacity. The one individual can't cover all the assigned duties. And so to ensure that we maintain proper inspection of our facilities, proper workplace safety, and submit those worker comp claims in a timely fashion, we're asking for a second person. When the Guard is in a state active duty status, then workers' comp is their avenue of relief. Having only one person to address all the members has proven to be a challenge in making sure that we meet the needs of the Guardsmen who are called out. So we're asking for that additional position in this as well. We could go to the next slide. Okay, here we have a request for the command post, as well as certain agency reductions. And going back to the protest of last summer, as well as our current posture in DC, this would give the DMA team the ability to have more command and control at the location, so that the leadership there is not having to find a location to engage in the operations. It was a challenge for us last summer, and it's one they've seen with the continuing call-ups. And so this is a request to provide that mobile command post. The items below that again, are agency reductions that we saw come from the special session. And not much more to add to that. If we could go to the next slide. All right. This was a request, and we thank Senator Marston for bringing this amendment forward to fully fund the National Guard tuition assistance. You can see there on the slide the projected cost from SHEV per year for tuition and fees. This would allow the Guard to fully fund our program and at least put us on par with those other states who already provide this service. Right now, we're not able to provide for every member who wants to utilize tuition assistance. In some years, we've had 506 students try to take advantage of it. We've only been able to fund about 400 or so of those. Other years, we had 536. And again, we're not able to fund those. So for those guardsmen who attend our colleges and universities, this would allow us to fully fund that program and certainly support our recruiting and retention efforts. And I would just add that our surrounding states, our sister states, already provide this service. And so we're asking that this funding be allotted so that we can also provide our guardsmen who are eligible full funding. This would allow for 500 members to be fully funded at our state colleges and institutions. We can go to the next slide. So in these capital outlays, again, these are safety issues, force protection measures that we're asking. Currently, you see with the previous amount for improvement to the armories, this is a continuation of that request to address our fire safety systems. Only 2 out of 47 of our readiness centers currently meet the standard to allow us to place personnel there. And so when we have a call up, we're challenged in terms of utilizing our armories for any overnight stays for our soldiers. So we want to get our fire systems up to code and increase the readiness of those other 45 readiness centers. With respect to the anti-terrorism and force protection measures, as you see there, again, similar, want to make sure that we put in place some of the items you see listed there, the camera systems, the ballistic guard posts, stop the small arms fires, things that will address the security of our readiness centers. Over the past few years, we've seen an increase in threats to National Guard facilities, not just in Virginia, but certainly around the country. And so we're looking to utilize the $1 million in bond funding here to address some of those anti-terrorism and force protection measures. If we can go to the next slide. And this is to improve the flight control tower down at Fort Pickett. It's woefully outdated and it's not sufficient really to carry out its current mission. As you'll see, the design we're looking at would give it a 50-year life on the new. This is, again, 100% federally reimbursed funding and will be utilized by obviously the current state agencies that utilize the system as well as the locality. But there are agreements in place to provide support for this facility in terms of its use. And so the request for funding would support expanding and improving the current flight tower there. Construction, as you see, will include a complete overhaul of the utility services, roads, walks, the fire detection and alarm systems, again, to reach that 50-year life expectancy. Right. And if we can go to the next slide, I believe this may be the last one. So here's that roll up. So based on everything that I've gone through with you, in terms of FTEs, there's really only one new FTE that's being sought with general fund positions. That $250,000 or the DMA does not include the request for funding for the tuition assistance. And I would note that at the bottom, the total NGF should actually read $6,673. It simply didn't add the DVS to the DMA NGF amounts. And with that, Madam Chair, I'll turn it over to you for any questions from the members.
Thank you, Secretary Hopkins. That was outstanding. Does any member have any questions for Secretary Hopkins?
Madam Chair.
Senator Marston.
Thank you, Secretary Hopkins. Very good presentation. Within the last couple of weeks, we have been made aware of some additional issues surrounding our members of the military and former members of the military, and And it's good to see that we're addressing some of the, the needs that these folks have. But the concern I have is that we're going to be dealing with problems perhaps for a while on the radicalization of some of our military members who seem to have been caught up in some of the violent activity, around the Capitol and in joining radical groups around the country. Is this something that your secretariat is addressing, looking into? Do you have any intelligence on that you can share? How big a problem do you think it's likely to be? These are things that I know have brand new to add to your plate, but they are of concern. And what can you tell us right now about what you know and what your thinking is for the future?
Good
Sure.
question. Good question, Senator Marston. Secretary Hopkins.
Yes, Madam Chair. And Senator Marston, to your point, whenever we get information about whether it's a threat within the ranks or an individual engaged in activity that would discredit the service to the Guard, we conduct our own investigation, and sometimes those investigations are in partnership with other agencies. I am aware of investigations involving non-state law enforcement agencies. So whenever something like that comes to our attention, we do engage in both an internal investigation and sometimes that leads to an external investigation. But that's not just with radicalization, that's just with holding the force accountable. So whether the issue is domestic violence, whether it's drug use, if it's participation in activities, say the ones in January 6th, we're always going to engage in an internal investigation from everywhere from the command level at the company level all the way up to the Adjutant General's office, if necessary. And on occasion, we've partnered with local authorities for certain investigations as well. So we're constantly looking into the force to make sure that, our members understand the responsibility. In terms of the scope, I would say that there's no way to know the scope, but I would say it's not a large number of individuals that we're talking about. I think the vast majority of individuals, they greatly love serving both this Commonwealth and this country. And the Guards, like the rest of Virginia, you have over 8,000 people with their own personalities, perceptions, views, political affiliations. But I think at the end of the day, they also understand that they have a duty under the constitutions of both Virginia and our nation to serve. And I think that's what they all try to do each day. But from the command level, and I've had these conversations with our team, we will engage and go forward to make sure that we address any issues within the ranks that might bring discredit upon the Guard.
Thank you for that response. Follow-up question, Senator Marston?
Thank you, Madam Chair. The one thing I'll say in the last 30 years that we have learned around justice-related issues is that responding to events and responding to behaviors is certainly important and is certainly necessary, but prevention and finding ways to make sure that these things don't happen and that people are educated and are forewarned of getting involved in these things and redirecting their concerns in more constructive ways is also a very, very important part of things. So I would ask you to also look at ways in which messaging can get out to folks that will reach out, allow them to express their concerns and what they're feeling, but at the same time, letting them know that it's a dangerous direction to go in while you continue your investigatory work that is also critical. So it's a three-legged stool, really. It's enforcement and investigation. It's intervention, pulling people out of situations that they're in that are troublesome, and then prevention, keeping them from getting involved in it in the first place. And I know you have a big task ahead of you, but keep us informed as to how that's going. And I appreciate all your efforts on behalf of our veterans. Thank you.
Thank you, Senator
Senator.
Marston. Other questions of Secretary Hopkins? Senator Norman? Senator Ruff? Senator Edwards? I've not heard anything from Senator Peterson. Okay, seeing no further questions, I'd like to, at this time, ask Caitlin if she would provide a brief staff overview for us.
Yes, Madam Chair, I am pulling up my slides at this time.
Thank you.
Okay, thank you, Madam Chair. So as an overview of the governor's proposed amendments for public safety and veterans, I will start with giving a summary of the 2020 special session legislative initiatives for your review. There was 28.9 million added and 38 positions. The biggest items were policing reform, DOC earned sentence credits, which on the third line, you'll also see that there was some savings assumed under the compensation board, and the mental health crisis alert system, which the majority of funding for that is in HHR.
Mm-hmm.
The other bills were compassionate medical release, patterns and practices investigations. There was a hate crime bill dealing with falsely summoning a law enforcement officer. That funding is for the Woodrum impact. And then there was a one-time grant fund created with general funds for body-worn cameras, equipment, and infrastructure. And then at the text in the bottom of the slide shows the other initiatives that were enacted, but they didn't have a fiscal impact, or the fiscal impact was indeterminate, so there was no funding added. Moving on to the introduced budget, a lot of this will be overview of what the secretaries just presented. For the general fund, increases were 0.8% above the base for fiscal year 2021, and proposal for a 1.9% increase for fiscal year 2022 above the base. The decreases that you see are related to reductions based on previously approved unallotments from Chapter 1289 due to concerns with revenues due to the, the COVID-19 pandemic. And then the largest proposed increases are for COVID response under VDEM, inmate healthcare, and state police equipment. And then as I'll go into ABC more on the next slide, but there's flexibility added under ABC for marijuana legalization legislation. So, moving on to ABC, as I indicated, there's startup funding flexibility given under the authority for a treasury loan of an indeterminate amount. JLARC has estimated that cost to be 7 to 9 million per year. There might be additional costs. I understand ABC is reviewing the legislation, and so their cost may be slightly higher than what JLARC has estimated. And then the note there is that there is additional funding proposed in central appropriations that can be used for expungement, which can include expungement of marijuana-related charges, and 5 million for impacts of legislation that's available in central appropriations, which can be used for criminal justice legislation or other legislation. Moving on to inventory, the proposed budget adds 138.3 million non-general fund for ABC to purchase wholesale alcohol inventory for retail. This assumes a 14% growth in fiscal year 2021 and a 7% growth in fiscal year 2022 over each respective prior year. There was no change assumed in the net profit transfers that would be required from the agency. I understand they want this flexibility in place so that they can provide sales related to demand, and they're not sure what level of sales will actually occur. And then the final item is 10.7 million one time for a human resources management system replacement for the authority. Moving on to VDEM, as I indicated, the largest item is for COVID response. There's 78.9 million. Of this, 74% is for PPE, and 19% is for supplemental funding and staffing to run the Emergency Operations Center continuously, and 6% is for the Health Equity Work Group. The third row shows a proposed restoration that the Secretary of Public Safety indicated for the Integrated Flood Observation and Warning System, and then the remaining amendments are dealing with VDEM's other capabilities not related to they're related to disaster response. They're not related to COVID-19, and they add a total of 3.2 million general fund and 9 positions, as well as some one-time equipment and finance and procurement positions to help the agency manage the large amounts of funding it receives. Moving on to DOC, the largest increase under that department is for inmate health care for the necessary cost increases based on expected inflation rates and anticipated use of services. The increase also includes an additional amount for hepatitis C treatment, and there is 3.6 million in the first year and 3.8 million in the second year for medical expenses for the state to reimburse local jails for state responsible that are housed in local jails for their medical expenses. On the second line, there's reference of funding, the proposed funding for the 25% state share for 3 board-approved jail renovation projects at Virginia Beach, Montgomery County, and the Peninsula Jail. And then the next line is the security staff for the new medical units at VCU for outpatient healthcare and Southampton Memorial Hospital. Moving on, the fourth line is the general fund support to replace non-general funds from the Drug Offender Assessment and Treatment Fund. The Secretary indicated that that revenue is down due to marijuana decriminalization, so this would provide continual support for the existing program, which supports drug screening and probation officers. The next line down is a position that would be transferred from the Department of Juvenile Justice. The Beaumont facility was administratively transferred in the interim to DOC, and you'll see an offsetting adjustment to decrease that appropriation when we get to DJJ. So this, the proposal is for that position that was already funded under the facility to move with it. And then the next line is the proposed bonus for the Lawrenceville Correctional Center personnel. As we discussed, the Chapter 56 provided a bonus to law enforcement officers and correctional officers, a one-time $500 bonus. The proposal is to also provide that bonus to the officers at Lawrenceville.
Yes.
Okay, and then the remaining lines cover, there's non-general fund proposed to continue chaplain services that is funded by commissary revenues. And then the next line down is the positions that we discussed with Secretary Moran for earned sentence credits. That's 74 positions. And you saw on the slide with the summary of the legislation from the 2020 special session that those positions support funding that was previously added in Chapter 56. So moving on to DCJS and State Police. The largest increase for DCJS is a restoration of 1.5 million, which would provide competitive grants for security measures to fight hate crimes in localities. There is also 0.7 million proposed for finance and IT positions to help the department manage its increased workload, including legislation that was enacted or passed during the special session to increase their workload. And then moving on to State Police, there's the proposal for 9.5 million to increase the funding the agency has for vehicle replacement. This is, as the Secretary indicated, the manufacturer has indicated that it will no longer make the sedans, and so the department has a plan to purchase SUVs. The SUVs are about 13,000 more per unit, and the department also has a plan to replace the vehicles sooner to avoid some of its maintenance costs. And then there is also a proposal for $6.4 million over the biennium for the phase 1 upgrade of the state police's transition to the VITA oversight environment. And there are 2 amendments for non-general fund appropriation, which those are funded by revenues in those programs. Moving on to the other smaller public safety agencies, there's $0.6 million proposed to be restored for forensic science for laboratory equipment maintenance and IT positions, and funding for an additional finance position. For DJJ, there's the $1.7 million that the secretary discussed for security improvements, and then the reduction you see is that position that's being transferred to the Department of Corrections. For the parole board, there's a proposed restoration of $0.4 million for a release planning coordinator and part-time investigators that were previously approved in Chapter 1289, as well as additional proposals of $0.3 million for a victim services coordinator, additional examiners, and a one-time modification to the Chorus offender management system. Okay, moving on to veterans quickly. The proposals, the net change proposed is a reduction of 10.9% in the first year related to the general fund in the base, and a reduction of 1.7% in the second year.
Mm-hmm.
And then going to the detail on the next slide, as the secretary discussed, there's the non-general fund proposed for the Camp Pendleton controlled access point. The general funds are 0.7 million that's proposed for partial restoration of the funding that was previously approved in Chapter 1289. As he discussed, they are for mental health positions, veterans outreach positions, and a one-time IT upgrade. And then for the Department of Military Affairs, there's the $250,000 that's proposed for PPE for civil disturbances, the mobile command post, and funding for one workplace safety and health oversight position.
Mm-hmm.
And Madam Chair, that concludes my presentation, and I will stay on for questions if there are any.
Thank you, Caitlin. That was a great presentation. Does any member of the committee have questions for our staff? Well, I guess that speaks to how well she presented. Well, if there are no further questions of our staff or any other presenters, I would like to thank each member of the Public Safety Subcommittee for your questions and your participation in this discussion. And I'd also like to thank Secretary Moran and Secretary Hopkins for being here this morning and providing us with additional details on this Secretariat's budget. If there are no further questions, no other concerns, with that, we are adjourned.